Welcome to another episode of Girl Talk. I'm Elizabeth Vargas.
And I'm Jody Silva.
I'm Sophia Joels.
Angela Peretta.
Dr. J. Calvert.
Dr. J. Calvert's in the house, my doctor extraordinaire. You know what, doctor? You have a lot of estrogen in the house today.
You know, I'm a plastic surgeon, so I'm used to it. This is kind of my shtick. This is what I do.
I'm so happy you decided you could come on today, because I've been wanting you to come on my Girl Talk podcast because there's so many things I want to talk to you about, so many issues I want to get into, so many things that so many of us women go through from a physical body standpoint that you helped correct, that I just feel blessed that you're here today. So thank you for being here.
It's my pleasure, and I'm glad that things have worked out. It was, we met under some unfortunate circumstances.
Yes, ladies. So I met Dr. Calvert. I had a very serious issue going on. I had a lump growing in my breasts, and I didn't know what it was. I had lumps on the side of my breasts, and as you know, we go get our the boob check? Mammogram. And I'm definitely over 40, but I'm not a doctor person. I don't get checked. I started feeling lumps, and then I started feeling not too good. I started getting rashes, and I started getting weird stuff happening with my body. And then next thing you know, I had a black mass thing growing. I don't know what that was, still to this day. And then I went to RHOC Hospital. My Dr. Barkey was like, he saw it and he's like, oh my God, what is that thing? Go to RHOC immediately. They booked me an appointment the next day. We did a cancer screening test. I had to wait to figure out what was happening. But in the interim, my Dr. Barkey was like, we don't know what's happening, but I think we're just going to take these out. And so I went to some doctors at RHOC Hospital, and they kept saying, we don't know what this is. Even the women doing the tests were like, this big bump. And I'm going to throw it up on the screen what it was. I'm going to show the universe what had actually happened to me. And I'm going to let Dr. Calvert explain what had actually happened to me and how he fixed it. But I'm going to tell you what I went through in advance. So I went through a horrific, what was that, 5 weeks ago, 6 weeks ago?
Yeah, about 6 weeks.
Yeah. And I had went through a moment where I thought I had cancer. I thought I had tumors. I thought something was wrong with me. And that feeling of going to get that cancer screening at RHOC Hospital by myself, like I almost want to cry now because it was so horrifying.
It must be so bad as well, going somewhere so emotional and then having people say, what is this? I don't know what this is. Moving you to different departments.
Yes.
And you want them to say, it's okay, this is just this, or it's okay, this is cancer. Just having someone tell you what it is helps, but you were passed through all different departments and no one knew.
Yeah.
Well, she was waiting as well. I mean, we were texting back and forth, and I can't imagine your anxiety. I had anxiety, and I didn't mean to keep it. I was like, I don't want to bother her, but I was so worried about you.
Well, I didn't know what it was.
And no one did.
And nobody could figure out. And I didn't know if I'm dying, if I have a heart, if I have a blood leak, because it was black. A big blood. I mean, I didn't know what was leaking, and my heart is right here. So I didn't realize the anxiety of not taking care of a problem. And I let it go for a year because I was like, well, that black thing, maybe I bruised it. I wasn't having sex, so I'm like, well, can't be a boyfriend, So
That's not hickey.
I thought, well, I don't know, how did that work, But in all seriousness, I just didn't know. And so finally I went and I got the screening, and they said, well, you've got fluid built up. You got a problem, but it's not cancer. Okay. I was happy as a clam, right, Dr. Calvert, but before I met you, I didn't know what to do.
Well, they also told you it's got to come out. We might not save your boobs.
Yes.
The boobs, the nipples, they're all going.
So they said, okay, Elizabeth. So I went to see the first surgeon in RHOC. That the breast center sent me to a surgeon, and he's like, we got to take those out for a year. You're going to be deformed. We don't know if we're going to be able to ever put them back in, but I'll take them out. Your insurance will cover it. I'm thinking, I don't give a fuck about insurance right now. I mean, that's great. That's fine. I'm blessed enough to be like, okay, so it's not cancer. I'm happy. But now how do I save the nips? And my right nipple was like dying. That looked like it was getting black. And I mean, it was horrific.
Being pulled.
I don't know what was wrong. So anyway, I interviewed 4 doctors, 4 surgeons from RHOC. Everybody's like, and I love RHOC, but they were like, you're taking them out. We're not going to put them back in. We refuse. So I thought there's got to be something. I went to my girl network. This is where girlfriends come in.
Yeah.
I literally put a 990-911, whatever. I'm like, anybody, everybody, I need a
doctor.
A doctor. I don't need a famous doctor, someone who wants to be famous. I need a doctor that's a reconstructive doctor because they were sideways. My nipples were underneath. I mean, they were pretty horrific. And guess who I found?
So tell us exactly
Dr.
what was
Calvert.
it? Because we never, during this whole time.
So I went into Dr. Calvert, and then I want you to start talking about what you saw, and sort of like, I actually, before I saw you, I wanted you to take my case. So I didn't move my arms. I didn't want blood to be flowing. So I wanted you to go, oh, she's not that bad. So no.
I know it's true.
I was like, I didn't even move anything for a whole 24 hours before I saw you, because I thought, if he doesn't take my case, I'm fucked.
Had you seen something like this before?
So what happened when I came in your office?
Well, yes, I've seen this type of thing before, and I take care of a lot of these problems, which is probably how you got to me, as somebody who I'd taken care of sent you.
Yeah. So what happened was, you were apparently this, I can't believe I never heard of you, was this world-renowned reconstructive doctor. Shows you understood the physiology behind reconstruction, not just put a boob in, but fixing issues, right? So that's what you specialize in.
Yeah, I do mostly, noses, faces, and breasts. And I do revisional. My biggest part of my practice is revision noses and revision breasts and facelifts. And the facelifts I even have a few revisions.
Fabulous.
Yeah, thanks. Well,
Can't wait.
Yeah, no, we'll get to it. But but like, I've been redoing, in fact, on my podcast today, we did a thing about revision facelifts and what to do when people take away the hair from the side of the face. But that's another story. What I saw when I came in to see you was a constellation of problems. It wasn't one issue. It was really about 6 or 7 problems all going on at one time. And that's why I think everybody just said these need to come out. And
no one wanted to take the risk.
Yeah, that was an option. For me, that was a last resort.
Would that have been the easiest? Is that the easiest method though, just to remove? Is that why they recommended that?
It's probably the easiest and probably the least fraught with risk and complications. But it's also, it makes more problems down the road. And that's kind of what we talked about. I said, we need to do a salvage operation. I said, this will probably take 2 operations. There's going to be one, we're going to save the situation with the first operation. And then I don't even know what we'll have to do in the second round, but there's so many things going on here. There's so many moving
variables
parts.
Were just crazy.
Yeah. And you look at that and they were big problems. It wasn't like a little problem. You had super thin skin. I said, you have an impending extrusion here. This is going, the implant is going to come through your breast.
First you take it out and just kind of try to repair this tissue.
Yeah.
But you don't know what it's like going in. Right?
Oh yeah.
Until you open someone up, you don't know what's
in there.
Oh, that's right. Because
I didn't know why you had the fluid
too, right? You had.
I was just going to say. So exactly, what was it?
So the things that I saw were retracted areolas where the incisions were totally tucked under, which is why I think anything you wore would have shown.
Yeah,
the problems.
I had big old bumps on my past podcasts. I wore like these nip covers.
Yeah.
I couldn't see anything.
You probably need to double up on them.
But they were like sideways, and it's like,
I mean,
I had to wear big nip covers no matter where I went, because I had I had 4 boobs.
Yeah, they were totally dent.
I mean, I had
4 boobs. Yeah, it kind of was like that because there was it was a retraction where the old incisions were. Then you had that black bubble was basically super thin skin that literally was about to give way.
So what was that exactly?
Just somebody took a sand wedge through there and chipped out a big
plastic
divot.
surgery.
Yeah.
This is all down to just literally bad surgery.
I don't know what happened. I wasn't there. It's not malpractice.
No.
So that's a whole different thing.
How old were those implants?
1 year.
1 year, year and a half.
Yeah, something didn't go right at the last operation.
Her body was rejecting as well some of the things that were in there.
Okay, so let him.
Yeah, so I thought, what is this fluid from? And that does happen. I had a patient who was doing some like aggressive Pilates and tore her capsule and got a fluid collection in her breast. That can happen.
Yeah.
Things.
No, this was
come
a
up.
black mess.
This was a
though.
mess.
This is a whole different story.
Yes.
Yeah, and I thought that the implant was going to come through that thin part of the skin.
Yep. I wore Band-Aids for a month holding my boob up. And then when I finally met Dr. Calvert, I wore the Band-Aids because he's like, I can see you in like 7 days. I didn't do anything hoping the implant wouldn't pop through my skin and ooze through. It was
So this was far beyond like what do they call it? A contracture?
Capsular contracture, which Elizabeth had also.
We'll get into that. Yeah.
Yeah, so she had capsular contractures on both sides. The left side was way worse than the right. And she had the folds where the breast meets the chest wall were off by a lot. There was a big discrepancy. And so the contractures of the areola is the impending extrusion,
the hole in the boob.
There were so many things going on that, and of course, I looked at it and I go, I can fix it.
Also like
I got it. Don't
Your
worry.
face though, I have to say though, when I went in, I have been crying for a long time because, I'm single and I thought, I just have this, I don't feel like a woman. And then they're telling me I'm going to be non-boobed for a year.
Non-boobed.
Non-boobed.
Non-boobed. But I was grateful because it wasn't cancer. I had all these emotions. I was like fresh out of the mammogram results. I got them in the mail. I was just so happy and sad. And I just thought, how am I going to date? The emotions were so intense. So when you looked at me and you said, I can fix this, I just remember my bubbly. I was like, oh, I went in my car and I like grabbed my steering wheel and just started bawling. I was like, thank you, God. Someone's listening to me.
Yeah. I mean, it was one of those things where I look and I see what I can do, what the plan is and how I can get it there. And I gave you I think a laundry list of things I had to do to make this work. And I said, if it doesn't work out, you're going to wake up without implants.
He told me that before I'm going to surgery. He goes, we're going to do the best we can to salvage this. But if your white blood cells aren't correct, right? Didn't you have to do a test on, when I was under, he said you had to do a test on
on the
infection.
Fluid.
If there was a fluid infection, they couldn't re-implant
I couldn't put
me.
them, if there was an infection, I couldn't put them back in because they just get infected
Oh
and we'd be in a
my
worse
God.
So that would
position.
just be like
So you
weeks or
woke up
months
with
later
implants.
that you do that.
So
Right.
Mike, so when I remember, when we were talking in the black, I was concerned about like staph or
Sure.
MRSA.
Of
That
course.
was is what I thought. But how long did her surgery end up taking?
I don't know. It was about 4 hours, 4.5
Yeah,
hours
you
or
said
so. I was in there
4.5
for a
hours.
while. Yeah, it was a lot. So the things that I did, I took out the implants, did a capsulectomy, took out the hard tissue. I released all the contractures of the nipple areolar complexes that were causing the double boob, as you called it. I fat grafted that thin
we had
area,
we have a
which
fat
was like
graft, skin graft in
like
here.
it was
Or
a
fat graft.
miracle that I could get fat into it, and I did.
Can I tell him where you took my fat from?
Sure.
I got my fupa in my boob.
Oh, I love it.
He's fat.
Yes.
I lost all this weight and I didn't know where to get fat from. So, and I'm like, can you, because I had a little poof. I'm like,
Yes,
can you
right here.
just
Tell the
take,
pooch.
is that fat? He's like, that's fat. And he only needed a little bit. So he just,
I'm here for that.
Yeah, no,
so.
I think you just liked saying fupa. That was sort of like-
Well, because you told me that was the name of it. I'm like, what's the name of that? I call it fupa.
Oh yeah, it's a fat pussy, right?
And then we did a skin
fat,
graft
ugly.
because the hole, right?
Yeah, so then we used a product that's basically acellular dermal matrix, which is, the dermis of skin to reconstruct the entire internal sling, the bra of the left breast. You didn't really need that on the right because after I did the capsulectomy, things were looking much better over on the
Will
the
this
right.
one sag faster than this one then?
I don't know.
I think so.
Yeah, I mean,
But we
like
should
I
do
said,
another
Wait,
skin graft one.
yeah, maybe
If
we'll
you
see.
think about it, like I always tell people, because I have another friend that went through a surgery at the same time you did, and she was like, one's dropping faster than, and I said, cut your finger on both sides. They're not going to heal exactly the same at the same time.
There you go.
Yeah.
And you also left and right handed. You sleep different on different sides. The same with
Yeah.
Botox. If one side of your face doesn't take as much, normally you sleep on it. I think it just goes with nothing symmetrical.
Yeah, and-
Nothing
and
heals exactly at the same time.
No.
It's very true, and that's the thing is that we were, I just wanted to get you like looking normal, and then how they heal. That's why I said
And
I'm sure we'll have to
obviously
adjust
healthy.
something.
Well,
Yeah.
they look
Yeah.
fabulous now.
Yeah,
Yeah,
they
no,
look great.
So does she have
We're
to have
good.
another operation?
We don't know. If this
I'm
does
5
the
weeks
job,
in. This is 5 weeks, and I'm trying to be like normal, but this is the first day I've not wore I have like a compression thing where it's like holding them up, just because I wanted to look fabulous today.
They looked amazing on day 3.
Yeah, they looked good out of the gates, and
you saved my nipples. So so that one areola was dying, that black spot. We're gonna eventually cut that out and then make them fix them, right? Because that one's.
I think so. I think we'll wind up doing some kind of adjustment. It's just.
But now this is just cosmetic to look better,
rather
than
just to make them awesome.
Yeah, because
just to make them awesome.
Well, because
exactly.
before it was a health concern. It was a worry. So now it's and was you in pain?
No.
Oh yeah, absolutely. So now Dr. Calvert, I have to say it's been 5 weeks since the surgery, and I really wanted you on because I think what I went through and I think a lot of women have gone through this where you don't know what that lump is. And I didn't realize that, and I was scared, and I didn't realize the stress in the back of my mind from not taking care of it. For a year, I didn't take care of it. And I can't stress to women enough. If something's wrong, take care of it and just check it out. Because I started feeling this, and I didn't realize this was a mesh now, right? Instead of cancer, thank God, it was.
So one of the things I found in there was some kind of a mesh, and it was
weird.
Not anything I'd seen before.
You see?
So crazy.
So
like possibly
I don't know what
somebody
it was.
left behind something.
Oh, they definitely put it in there to control.
Was it on both sides or just one?
One of it was to fix another problem.
It was only on your left side.
Because they put a hole in me, put a mesh in me to try and cover up the hole.
Yeah, and it did. It seemed to sort of like retract up. There was some on top and some on the bottom of the implant. Some up here, some down here.
Was it at least medical grade?
Was it like the fence? Did they just go grab it? They're like, somebody, go get it. Does anybody have a screen on their door?
It almost sounds like, when you got a hole in a wall to plaster, they put a mesh on before.
Well, also, her pocket, it had slid in. Did that open?
Yeah. Oh, yeah. The whole thing was a mess. It was, and so I don't know what the mesh was. I suspect it was some medical grade silk mesh of some kind.
I was allergic to it or something because my body
wasn't working.
It was horrific. And I was getting hives and I was getting headaches. I don't get headaches ever. I've never. I started getting headaches. I started getting little rashes, and I'm thinking, I started Mounjaro, and it must be one of those things. I was trying to blame it on everything but the implant. Or not the implant, but just what was going on. And it turns out, and then the black mass grew, and then I started getting itching, and then I started getting pulling here, and I was like, oh my God, and then I would get like this weird sharp pain. So I went to the hospital 3 times last year thinking I was having a heart attack. 3, I checked myself in like, I'm having a heart attack, but I was having this sharp pull from that probably, right?
For sure. And I don't know what it was. And, so I asked Dr. Ravello, who is my co-host on my podcast, and I said, do you think that this is this mesh or that mesh? And, and she just was like,
we don't even know.
So you never figured out exactly what it was?
No, but I would hope that we could find it in the operative records of what was done before.
Because it was a year ago, your surgery.
But I've had 3 boob jobs, so I know I've had multiple boob jobs.
The last doctor,
but
a year ago,
everything
would have said that was already there, or no, this is this.
Well, we'll find out
product.
when we get the records. We don't know. I'm not. I'm not. Here's how I look at it, and this is how I look at life. Like you're gonna go through life, and you're gonna go through situations that this was horrific for me. I was by myself. It's like I just didn't. I'm sitting in my bed alone, like with my dog, going, "Am I dying? What the fuck's happening?" You know. And so going through that experience by yourself is just horrific. And calling my mom, not knowing. I don't have family here, so how am I going to get to the hospital if something happens to me? I mean, there was so much emotion with this big mass growing that, where am I going with this? I don't even fucking know. I'm so like traumatized from it. But just
letting it go. That was a story.
Yeah, sorry.
Then.
Just letting it go and knowing that we go through so much that it's just being able to find the right doctor, being able to find the right support system, the right girlfriends, the right friends, reaching out. I didn't reach out for a year because I didn't want to tell people I was getting deformed. So the importance of really reaching out, the importance of finding the right doctor, and you were very good at listening and not just pushing me aside. And I'm a listener, and I've dealt with a lot of surgeons, but and I mean, you've had some issues as well, right?
Yes, I had. So when gummy bears first came out, and I had,
The
I
gummy bear
gummy bear
implants.
yes, yes, yes.
Implant.
Not the gummy
Yeah,
bears.
definitely.
Because that's a different story. Gummy bears can be.
So I
Yeah.
have lupus,
Yeah.
and I had gone through chemo and everything, and I have my own breast tissue, but they deflated significantly after chemo, and I had to wait like a year and a half until afterwards, and then I was told that gummy bears were the most natural. It's not. Roger was against it, but he said whatever you want to do. Anyway, and this goes to where you said you left it for like a year. So probably about 2 years into it, I started to realize like something was raising. I go, is it just me? Because women are so hard on themselves.
Yeah, we are.
Is it just me? Is it just me? I go, I feel like it's getting higher. And I had
Capsular contracture.
yes. And
it hurts. It pulls.
it did. It
Painful.
hurt. It really hurt. And after my surgery, they found out I ended up going to a reconstructive doctor as well. And it had split inside, and it just little, like, when you chew a gummy bear, little pieces go everywhere. And according to Mentor, they said that it was either forced upon insertion so hard that it ripped and it just slowly tore over a couple years, or upon the closing, that somebody had nipped it. And so when I had to have mine redone, they had to scrape the whole muscle like on my chest.
Ugh.
It hurt for years.
Or to make sure
Like-
they got all the little pieces.
All the little pieces adhesive like to my muscle on my chest wall. And it was just for the longest time, it was painful.
They
And-
can be very painful because the capsular tissue is scar tissue that's kind of gone crazy. It's really pulling on everything, it's contracting, and it hurts because of it's pulling on muscles, and you're getting muscle spasms. So that is one of the big issues with silicone breast implants, is that capsular contracture happens, depending on which study you read, somewhere between 3 and 15% of the time.
Wait,
but
just silicone or saline as well?
saline also.
Mhm.
Oh, okay. So
Yeah.
both.
Yeah.
You said silicone. So I was
Yeah.
like, okay, so there's no
Silicone-
difference between
No, saline supposedly has a lower
capsular contraction rate.
but that hasn't been my experience. I think they're about even. There are some new implants coming out now, and that I think are going to address a lot of that. And the implants that I put in for you are the ones with the lowest capsular contracture rate
Yeah.
of all the brands. And I'm not going to mention brands because I don't want to be
Yeah, we'll keep
shot
everything.
by somebody on the way out of here.
Sorry, I
You said
mentioned.
so-and-so. That's okay. You can say whatever you want.
Yeah,
I
Big
got a
Pharma.
different.
There's Big Pharma
I know.
around here.
I
We're
went
not
with
talking.
saline.
Yeah.
The next time I
Good
said,
choice.
you know what? I'm going to go with saline.
I think
Well, yeah.
Yeah,
And
you
I was just going to say, just do your research too, and really have that great relationship with your doctor, because I had a botched surgery and I had a uniboob. So,
Oh, wait, what happened?
Which is is it called loafing?
Synmastia, but
Synmastia.
loafing's a good term for it. Though. That's kind of what it looks like.
That was
It
Like a
does.
loaf of
It
bread.
looks like a
Yeah.
loaf of bread.
What?
I never heard that. I'm going to
So,
use that now. I'm going to put that
this-
on. That's for the next podcast for me.
Yeah. This was literally my skin. Like I could
Yeah,
not
that's what
touch
it looks
my
like. Yeah,
breastbone.
yeah.
It was skin straight across. And I went back to that surgeon, and he tried to just staple it down.
What?
What?
Right? Now keep in mind, this was probably 20 years ago. And then I just lived with it. I was just like, forget it.
For how
whatever.
long?
Stapled
Too
it
long.
down.
Wait, he
Stapled it
stapled it down?
Stapled it down.
Dr.
Did you see it
Calvert,
from the
look at what you're
outside?
fixing. Look at the mess you have to fix, the ladies of the 90s.
Right.
Right here.
Ladies of the
Disasters.
90s.
What?
Midwest surgeries.
Yeah, I'm telling you.
But
So-
wait, how long did you live with it like that?
You have a headache?
I lived with it for years. And then finally I was like, I'm done. I'm done with this.
Well, you look great.
I'm going to go have them redone. And I saw Dr. Linder in Beverly Hills, and he said, we have to take them out. He's like, we have to take them out. I want this to heal.
Got to heal first.
It's got to
Yeah.
heal.
That's one way to fix it too.
And what
Yeah.
I loved about him, and I had friends that had gone to him or researched him, I talked to other surgeons that wanted to wire everything down and to get everything or put in a pig.
Yeah, you can use an acellular dermal matrix.
Yeah.
You can do that. You can use a mesh. You can suture it.
Right.
Synmastia repair is difficult.
If I could whip my dress down, he did a fabulous.
I can see
I
right
want to
now.
flash
I have
everybody
the
too.
Grand
I'm like, I want to show my
But
They look amazing
you know,
now.
when I was having them taken out, my girlfriend's a nurse, and I said, he wants to take him out for 6 to 8 months. I go, what do you think that's going to look like? And she was like, horrible. I was deflated
That's a
balloon,
true friend.
right? Yeah.
Yeah.
But he took him out. It really didn't look that bad. And I told him, I said, when we go back in, I want teeny tiny.
So how
little
long did you
implants.
take him out for?
I ended up taking him out for about 9 months because I actually enjoyed. I enjoyed
moly,
having
no
them out.
boobs for 9. Were you
No,
married still?
Still. He stayed with me.
Oh, thank you, babe.
Yes,
Jesus.
He is still there through it all. But I've never been happier to be able to touch my breastbone. Like I couldn't touch my
That
breastbone
is
for-
crazy. I never even
Yeah.
heard of that.
You don't realize the things that, I mean, as women, we're the most critical of
Yeah.
ourselves. And so for Elizabeth to go to you, I remember when she met you, she goes, I found the most amazing doctor. And she was crying.
Yeah.
It was.
And she was, and I go, I was grateful for you and I had never met you because she
Wow.
had so much relief. And I go, as women, I don't think people realize how much it means to us.
Yes,
You know, the
to
things,
fix.
I mean, the
the
fact that
things.
you're sitting here rubbing, I mean,
right? If you
yeah,
catch me
and
going
I'm
like this,
I'm
it's
like, I
just
still have my boobs.
Just happy
Yeah.
to feel my sternum.
Yes, I
There
think,
it is.
I
There
think
it
it's
is.
also funny that we all
manubrium,
sit here. We've
yeah.
all got different stories, and you do as much research as you can. But back when you do your research, you've only given what you're told.
That's right.
So I had my first boob job when I was 24,
Okay.
and I in England, and I had teardrops because back then they would.
Teardrop. What's that?
So then,
the shape.
The shape.
did they ever come to America? Teardrops.
Oh,
Yes.
They
Yes.
did. So I
Pass.
Oh yeah.
and so they basically meant they were told they meant to look natural, and they did look great when I had them. But after I had children and breastfed, they turned. One turned, so it
What?
turned. So the teardrop would literally look like a teardrop, and it had turned. But I didn't know that it turned. It just was stiff, so I could no longer get a cleavage. And I just thought, oh, it's
You
fine.
couldn't do like.
I couldn't do I couldn't do this. So, but at the time, I was like, it's fine. They still don't look bad. They look great in clothes. I'm not a topless model, so it's fine. And then after I breastfed my second child, I was like, I'm just going to go in and just see what they say. And I thought it was my right boob that was the issue, but it was actually the left boob that had moved so far the other way. And it was Dr. Nicoli. So he said, actually, I went and saw 3 doctors. He was the only person that really told me exactly what he was going to do. The other's like, whatever you want, we'll do 600, 700. And Dr. Nicoli went, you will look ridiculous.
Yes.
He goes, I'm going to put in no more than 400. If you don't like it, you go somewhere else. And for some reason, I went, that's my guy. So I went back to him and he said, you completely had turned, scar tissue had moved it to the side. So you had to scrape it all out. I wore drains for like 2 weeks.
Mhm.
It was like mustard,
Same,
like yellow and
same.
had like a yellow
Yeah,
pus
same,
and blood.
same.
You had drains?
Oh, those are horrible.
Yeah, they're so horrible.
Oh.
2 weeks. I remember going back
it
and
makes
they
me just
and they
hurt
when
right
they pull
now.
them out. Oh,
They do it so
Ah.
fast. I did set her. She was talking to me, and I go, they're gonna count, and I go, but
it goes
it's
on
not
2.
gonna. It's not
She's
gonna
the
be
one
on
I
the
talked
actual.
to when I said, "Oh my god, oh my god, oh my god," and he was done.
because they get one.
I go, they're gonna do it before you even know it. They're gonna tell you a count, and it's not gonna happen on that count.
I took yours out and I took them out and I was like, okay, are you ready? I'm going to take them
Because
out.
I was all
now.
nervous. I'm like,
But
okay,
yeah.
but
I'm
the
ready.
drains were already out. And she was like, I was like, well, they're already out. And you were like,
Oh,
That's
that
the
was
best.
so
When did that
funny.
happen?
Best
Because
doctor.
I knew I psyched myself up.
Because they do, they go 1 and they're already out.
Yeah.
And they
You know, it's crazy about implants, you know, and plastic surgery and getting I got a breast implants first a long time ago for me. I wanted to be able to fit in some cute shirts and really it was just for me. And then I ended up, you know, keeping them now and I'm this years old and I still have them. And so I'm 49 and
We're
they
the
were
same
like,
years old.
I'm this years old and I'm just learning about teardrop. You know, I didn't even know that happened. But, you know, and boob, una boob. Was that una?
loaf boob.
But, you know, we do this and we do it for us.
Mm-hmm.
And when you get a bad plastic surgeon and there's so many out there that where do you go next? There's
Right.
so much bad plastic surgery. So, you know, everybody has everything. You know, these surgeons are all like, I'm fabulous. Commercials and they're sitting at their desks. And one thing that caught my eye with you, Dr. Calvert, is when my girlfriend referred you, Deanna, and Beach Bunny Fitness, because I'd heard she'd had everybody was being fixed. And they immediately, your office sent me a link to a podcast.
Yeah.
And it only had like 200 views. And I'm like, eh. But then I watched it and it was so educational that I realized that those 200 views were 200 women like me.
Mm-hmm.
And out of all the world, those women, I bet you that meant the world to watch that one podcast that you educated me on. And the fact that you educated me, I was like, that's my problem. Excuse me. I'm like, oh my God. They're explaining to me what I'm going through. And so tell me about your podcast. Like you guys do a lot of talking about everything.
Yeah, we've done over, I think we're at 270 episodes now.
Wow.
And
it's
yeah,
amazing.
we've been doing it
Anything
since
you wanna learn.
2019.
I would love to listen.
Yeah, it's called the Beverly Hills Plastic Surgery Podcast. I do it with Dr. Millicent Ravello, who's my associate. She was a resident, and then when she finished her residency, she moved into her office, and she's been there since. And she and I do this podcast where we talk about literally every topic in plastic surgery. I mean, we do talk a lot about the stuff that we do a lot of. So she and I both do complex breast. I do a lot of rhinoplasty. That's kind of what
I
I'm
heard you're the nose.
yes, yes.
You're the nose doctor to the stars. I just heard.
Yeah, I mean, so that's kind of my thing is that,
Can I say?
you can say whatever you want. Of course, it aired. You can say anything
Terry
you want.
Dubrow.
Here we go.
How do you guys like the nose?
Yeah.
What's up with that?
I think he's happy. I think Terry's happy with his nose.
Crazy he decided now. You know what?
Yeah, why now?
Now's the day.
So
no, but he
I
had an
don't
issue, right?
Yeah, he would never have rhinoplasty. I mean, he did it because he couldn't breathe. Like Heather was like, Terry, you're gonna like wake up dead one day from not being able to breathe. She said it was like sleeping next to a freight train. He's snoring like crazy.
Did he have a mask on when he
That's
slept?
my husband now.
That's my
Yeah,
husband
and
too.
he didn't do any of that, but he also noticed it too. It wasn't just her, but
Yeah.
he was like, so he FaceTimed me one day, like during my office hours, and I picked up and he's like, hey, how about you fix my nose? I was like,
Sure.
yes.
You're all please.
Now I can come down the hall.
What do you want
when
me
you
to
want to
do?
do it now?
What do you wear?
I'm outside.
No,
right
I mean,
now.
Terry and I are really good friends, and Heather, and we're close because we just have known each other forever, and
And they both look great. I mean,
they
they
take
do.
great care of themselves.
I have
Yeah.
a question though. What is entailed? So my husband, I always send these memes that are jokes about the way that he snores. I mean, he wakes himself up.
Oh yeah,
Like from snoring, like
that.
And sometimes I'm thinking, I go, how long is it going to be until he breathes again? And he's like,
Yeah.
doing that.
Is that what Terry
So-
was doing?
I don't know if he had
Have- have
sleep
you- have-
apnea,
have
but
you
it was
slept
just
with Terry to know.
No.
So what's entailed
I have
in
not.
that?
Wait, is that sleep apnea where they can't?
sleep apnea is what you're talking about.
Yeah.
Yeah, when
He
you
just, but he's
Catching
always
their breath. Yeah.
He does that occasionally.
I thought maybe they were just
But-
choking in their sleep, like like having a good dream.
nope, they literally are like not breathing, and
And is that just because then their nose is clogged, or they go into a very deep sleep?
it's typically two things. It's not just the nose; it's also the palate and the soft tissues of the throat. So that's why when
The
you lay
patella?
back,
What is
the
that
uvula,
called?
yeah.
Uvula.
Okay.
Right.
patella, uvula. Yeah,
Yeah,
but yeah,
patella's
the uvula.
Oh, yeah.
I mean, it's close. It's in the
in the
body.
body.
Yeah, so that's good.
Anatomy schmat.
The patella is one of my favorite words to say. But the uvula and the soft palate and also the sidewalls of the pharynx just cave in on your trachea, on your windpipe, and it's just flopped over and you can't get air in.
Can
So
people
they-
die from this?
Yes.
That's so
And-
crazy.
and
I
this
thought
is-
they just snored.
I would hate, like, if I really think somebody's going to have a big problem, I have no less than 6 stories of total disaster with sleep apnea. So you need to get it fixed. It's for real. And you can die, you can become brain dead, you can have all kinds
It
of
would suck of
problems.
oxygen to your brain.
Does it start with the
Of
nose
course.
and then it goes to the neck, or how do you know they have it?
You have to do a sleep study, but like the story you're telling is sleep apnea.
Yes.
So like I don't want to tell any of the stories.
Brain
'cause, I mean,
problems?
I'm.
Well, if you starve
there
your
was a-
That
brain
would
of
be Roger.
oxygen,
Okay,
It is.
ready?
I mean, she's
brain
heard stories.
problems.
If he sits for too long, he will fall asleep.
Well, that's good. It means he's working hard.
I was like, he can't. but
Maybe he has a
snores-
job. Maybe
Well,
that's
maybe we
why.
have
Two
Did
new
you think
patients,
about that?
her husband and my husband.
I mean,
Same.
it's scary.
I mean, do you do do you hit him in the middle of the
Oh
night?
gosh, sometimes I'll pinch his nose, and then he wakes. I'm like, And I tried because it's hard to go back to sleep. I mean, he'll wake me up and then I'm stuck.
Right.
He needs a sleep
watching.
study. I mean, he definitely needs a sleep study. But
I agree.
So Terry Dubrow, so let's go back to Terry real quick because, the fact that Mr. Botched I didn't know, by the way, you'd already done his nose and that you were going to be on the Orange County Housewives episode when I met you. I didn't even know you knew any of the housewives.
Yeah, that was over. That happened.
You'd already filmed it.
Yeah.
So you wouldn't tell me. You're like, I'm kind of related to the housewives. I can't tell you. And I'm like, whatever. Maybe it was one of the older housewives, but I didn't realize it was actually Terry Dubrow that you...
He's sort of a housewife.
But
he's a house husband.
But he chose you over his
But how he chose
partner.
you over everybody. So you are fabulous.
You have to talk to him about that. Paul's great too. I mean, Paul Nassif and I are really good buddies. And I taught Paul a lot of the rib work that he does, using the rib grafts to reconstruct noses.
I've seen that.
Yeah,
he takes because that's the closest thing to the cartilage in your nose. Correct?
Yeah, and it's very strong, and that's basically what I use a lot in my revision rhinoplasties. I do about 80 of those a year, and
wow.
And Paul is very good at it. And Paul's a really good surgeon, and for whatever reason, I don't really know Terry's reasons. I never said like why me over Paul, but he's just
for
like
business partners. I wonder if you just want to keep things separate.
I think so.
And it could just
Paul's
be that
amazing.
it's nothing to do level of respect, but out of business partners, I'm going to go into another respectable doctor, or Paul was busy. We had a full schedule.
Paul is very busy.
He is.
I'm sure Paul's relieved he didn't have to do it.
Agreed.
It's kind of like your spouse doing your surgery.
Yeah.
Probably.
Well, that's what I was thinking.
And you also can't sue your business partner.
So you can't sue doctors anyway.
It's really hard to
you
sue.
sign your life
Especially
away.
in California.
Hey, can we go back to the whole rib thing? Can you take out two of my ribs and put it into my nose?
Prince.
Sure, whatever you need.
But you don't take out the entire rib.
Didn't Prince have
You just take out a piece of it, right?
Yeah, like that.
Yeah.
So I have a question going back to the boobs. What is the most popular shape?
Wait, you can get a shape boob? I thought they were all round.
gotta be
there's
round now.
teardrop, high
No,
profile,
teardrop's
low
out.
profile, more
So
round.
Mostly I do round high profiles are probably the most common one that I do, but I also do a lot of the little bit lower profile, the moderate plus, and I'll sometimes do like a moderate plus extra filled.
What's this one?
Yours are moderate plus. Yeah, we did not do the high profile.
Oh, thank God.
And,
I don't want the Pamela.
mostly behind the breast.
I need
behind the muscle.
49-year-old
Yeah.
boobs,
Yeah.
not 29-year-old
But do
boobs.
you
I need
see-
them to know what they're getting. It can't
Well,
be
there was a volume consideration that caused me to choose the shape and size for like the selection of the device dictates the level of success of the reconstruction. So
Really?
Oh yeah. I mean,
What?
breast augmentation is so complex and people try to make it into this very simple thing. And it is not easy. It is not, it's easy to do from a surgical standpoint,
The science.
sort of, but there is a way, there's a reason I do all these very thin fitness models that work out, lift weights and compete, because how you set them up for success with the selection of the device, where do you put it? Do you put it subfascial? Do you put it under the muscle? Do you fat graft over it? All these considerations. Is it high profile? Is it extra high profile? Is it a moderate plus profile? What size? What's the volume? How wide is the base width? All that is what I do when I'm sitting there looking at the situation that
You're
I'm
like,
in.
I just wanted big
And-
boobs.
I just know I woke up with boobs and I'm like, I was so thrilled. I'm like, he saved the nips and the tits.
Yeah, no, they look good. Because I think we got the device right. That's the key.
Yeah,
have to
and
see
they
an
feel
artist.
great. They feel soft. I haven't had soft boobs in I don't know how long.
Yeah.
They actually feel like real implant, like real boob. I don't know what those feel like. These are I've always had.
So
fake ones,
also, what's the most popular? I've heard like people now are going over the muscle, whereas a minor under.
but- oh yeah,
I do both. I go under the muscle. I go
What are
So
mine?
would be more
subfascial.
candidates for under and over.
So I'll do subfascial if there's which I typically don't put it right under the breast gland. I'll take the fascia, the thick coating of the pectoralis muscle up so that there's a separation between the breast gland and the device. So that fascial layer makes a difference, I think, in capsular contractures. That's just my opinion.
Can you explain again? Capsular contractures just scar the capsule just tightening.
It's the normal scar tissue that forms around the
So there is a
implant.
scar tissue that forms around the breast from your body rejecting it, or just in general.
It just gets too thick and too proud and contracts.
Okay.
And it can be painful. So that
How does a woman know that she has capsular contraction? Is it because
You
it starts
feel
hurting or what?
It goes harder as well, doesn't it?
It goes
It's
hard,
hard.
and it lifts,
It gets
and
hard.
it hurts.
right. When you feel
It
your
hurts.
breasts now, they feel nice and soft and
Right.
they're mobile and they feel great. So when they stop feeling like that, that's a capsular contracture.
Okay.
So, as an aggressive Pilates girl myself,
Oh yeah, you're the whole Pilates. Yeah.
for the fitness girls, then you say you do a lot of fitness girls. Are you doing under or over the muscle? Is there a preference that you do for the girls that are big fitness girls and are moving and working out a lot?
I probably 83% of the time go subfascial.
Mm-hmm.
And about 17% of the time, there's a reason to go submuscular.
Yeah.
And those reasons are variable.
Can you do that in layman's terms?
Subfascial meaning under that thick coating of the muscle, but not under the muscle.
under,
I'm
yeah.
peeling the kind of the
Saran
layer.
wrap.
Yeah, there's
Okay.
a thick layer of tissue over the muscle.
Okay.
It's not that thick, but it's enough that it separates the breast gland
Okay.
from the implant.
Okay.
Because I think capsular contracture is caused by several different things. We don't really have an answer why it happens. But one of the things is I think that the breast has ducts in it that communicate with the outside world. And there is a low level of bacterial contamination in the ducts, which is normal. But it also creates inflammation. And so I think having the implant right up against the breast gland may not be awesome for capsular contracture formation.
Okay.
So that's why I like to put it under the fascia. But if I really need more coating, like they want it to look more natural, whatever that is,
thinner, maybe.
if their skin's too thin, then I'll go submuscular. But that's a trade-off depending on what the fitness model does. If they compete, if they need the implants to be, less obtrusive. I mean, you see some of these competitions where it's like these incredibly sculpted muscle girls with two like round balls on their chest, and it doesn't really look nice.
Yeah.
It's not
Right.
pretty.
Yeah, but you know what's so funny? So I actually did a fitness competition and I had the same breasts as I do now then. My breasts now look so much better because I'm not that super muscular
Right.
frame. So it wasn't that the breasts were done wrong, but my body shape became so much broader here that it brought my breast out further than they were. And now I've not so aggressive with my fitness. I'm more, I guess, lady looking, but my boobs have come back into themselves. So it was the same breast, just
Your
on
boobs
a
came back into your
they
lifestyle.
did came back in. So I went from being super muscular, did all the competitions, and then just became fitness. Like I like fitness, and my boobs, same boobs, but they look better now, I think, than what they did when I was competing. And maybe it's because when I was competing, I technically should have had bigger boobs to fit my frame of body. So I guess
What size are your boobs now?
I got 375s and I'm a 32 double D.
375. And because you're tiny, you have a tiny. What size clothes are you? Size
Extra small,
extra
zero.
small,
But
zero.
32.
See, I think I have 250 and like 265 on one side, and I'm a 32 double D as well. But I had a lot of my own breast
Yeah,
tissue.
it just depends
Yeah.
on what you're starting with and the shape of the chest wall. I mean, there is a real. I mean, that's one of our. I don't know which podcast episode did we send to you? Was it the capsulectomy one?
Yeah, capsulectomy.
Yeah. So, but
it was great.
Yeah, I mean, it's like we get into it. Dr. Ravello and I would really go after the topics.
How did you? I want to kind of go back to your podcast and because I just am so blessed to have been able to watch it. I think education is key. And there's so many physicians out there. There's so many doctors. There's so many options with just surgery in general and there's lack of education. I think you see social media, you see, TikTok and Instagram and these perfect people. And you're like, oh, I want that. There's trending face things where the ponytail, there's trending boob jobs, there's trending get butts, then take off the butts. But how do you, as a person, sometimes, the mommy makeovers. I mean, I love that there's a mommy makeover because you've had these babies. You just want to feel good in your clothes again. And there's that option to have a mommy makeover. But who do you go to? How do you educate yourself, Dr. Calvert? Where do these women go? Say I'm in Montana right now. Where do I go to find the right doctor in Montana? Is there a database? Like, where do people go besides watching your podcast? I could imagine if I was in Montana, I'd fly to freaking Newport to see you. because I know I'm going to be in America. I'm going to get a good dog. Let's talk about this.
Yeah.
People fly to Brazil. They fly to all these countries.
Tijuana.
And there's if there's something goes wrong, there's no help, right? So don't you think stay in America, right?
I followed it.
You know, I think there are, look, I have really great friends who do plastic surgery in a lot of different countries around the world. I don't know if those are the doctors that people are flying to from the United States in general. The way that I see it is if you can find yourself a board certified plastic surgeon in your area that you can afford,
And that's
then that's what
another
you should
thing,
do.
isn't it? And it's a shame that money has to become part of the reason why you go and see a doctor. So you want to see this doctor, but this doctor, argument's sake, $10,000, but this doctor is $5,000. Am I still get my boob? Sometimes price drives you somewhere where you don't want to be. And at that point, it's difficult because it's cosmetic. It's not because you're sick. So to take money away from your family, technically, you go for a cheaper option. I know you pay twice.
But then you could die in Brazil.
You pay twice
and
sometimes.
I
but
mean,
I think it's hard when money drives you.
yeah.
And
I mean,
you-
for a typical person, I agree.
Yeah.
But you know, it doesn't mean you can't have problems here. You
Of-
know,
of
surgery
course.
is fraught with, complications, and anybody who says, "Oh, this is easy," like they don't understand really what they're doing, because there's nothing easy about surgery.
I mean,
it
even
is very
putting someone to
complicated.
sleep, period.
Yeah,
is
it's
risks.
all hard, and it all has risk. And every day I walk into the operating room, I say a prayer for my patient, and I say a prayer for
that.
myself, and it is, I just want to do the best that I can for them, and that day is the opportunity for me to do the best operation I've ever done, and it should be, right? Because I have all my experience, I have everything that I've learned, everything that I know, and it doesn't mean it's going to turn out right, and that's the hard part about being a surgeon. And people don't, we own that stuff and we take it home with
Yeah.
us. And so when you go somewhere else around the world, and I could tell you such horrible stories that I think you'd be shocked, and I don't think anyone would charge.
I've heard quite a few of them on TikTok.
Yeah, I mean,
Heard a few today.
there's some going
Yeah.
for mommy makeovers and coming back without a kidney. Have you heard that kind of
Yeah,
stuff?
I've heard.
Oh.
Yep.
So
That's enough to stop you.
And that Netflix series, not that it's plastic surgery, but the Netflix series of that 100 Fathers or something, when them poor women went to get IVF and they went with their spouse, or they went for a sperm donor, and this doctor was using his own sperm, and he fathered over 100 children within the same. Was it called 100 Fathers?
Something
I mean,
like
just
that.
the
It was-
twistedness.
But I think the people that travel outside of your region or your area, I understand the money factor, but is it worth your life? And I don't think it is.
So yeah, we buy cars, and cars are expensive, and plastic surgery is usually, like, when I was growing up, the thing I think that got me interested in rhinoplasty so much was a lot of the, very cute girls in my high school class got these terrible nose jobs by these guys that were in
Where
practice
did you go
near
to
my
school?
I went to Milburn High School in Short Hills, New Jersey. And so I grew up
you're
in Short
from
Hills.
Jersey.
Yeah. Hey,
All
you from
right.
Jersey? I'm from Jersey. I can Jersey with the best of them.
Welcome to Orange County.
hey, that's right. So, and I just hated these nose jobs, and they took all my friends and they made them look weird, and they were terrible. So I think that's why, subliminally, I turned into a rhinoplasty surgeon because of that. But
What a great
I really
story.
I just felt terrible for them. They were ruined.
So I've heard that a rhinoplasty and a foot surgery are the two most painful surgeries that there are.
I don't know that rhinoplasty is that painful. My patients don't complain a whole lot about
Have
nose
you had?
jobs.
Has anyone
Yeah.
had a rhinoplasty?
Oh, me. Duh.
You have?
I've had like everything.
Yeah. So I mean,
No, I had
I want one. There's a bump.
I ran the LA Marathon and I almost died. I couldn't breathe, and I got done, and I had all this red on my gums, and it lasted forever. And I had been training for this marathon for 6 months. I didn't think breathing through my mouth I didn't even know I breathed through my mouth.
You was a mouth breather.
I was a mouth breather. I didn't even know there was a
I'm
difference
glad you
between
got that fixed.
going.
yeah, you need that fixed.
No, there was
I
like
think we could be
okay,
friends.
Dr. Calvert, back me up here.
Yep.
There's like you breathe in through when you're training.
Yeah, you want to breathe through your nose.
I never breathed through my nose. I never even growing up, because I had raced a bike when I was a kid and hit a car and flew over the car and hit a mailbox and broke my nose in many places. My mom's like, yeah, you broke your nose a long time ago. Never even knew it. So here I'm training for this marathon, just breathing through my mouth. Well, I got an infection on my gums afterwards. Couldn't figure out what it was. And I I was like, why?
Gingeritis
Because
or
I was like,
something?
just breathing through I slept with my mouth. I slept like that. I never breathe through my freaking nose. So I
Much
go.
better now, huh?
Well, I went and I went to this doctor for my gums. And he's like, yeah, you're a mouth breather or whatever the fuck that is.
It's funny you say that. When I used to do spin, I always felt that if I breathe through my nose, I did way better in the class than when I tried to breathe through my mouth.
Well,
it was
You
exhausting.
actually get more oxygen when you breathe.
Yeah.
Okay,
through
so
your nose.
here's what they did. So I went into this doctor. He's like, you got to get this fixed. So I go into this doctor and he literally, I didn't have enough cartilage and I didn't do a bunch of blow. I wasn't like this blow person,
Well,
you
we
know.
We didn't say anything about that.
I'm just saying,
You
like,
said
because
that.
you know, because they always are like, he's like, oh, so you don't do. He literally said that. He was like, oh, well, you have a good amount of cartilage. Some people don't have. I go, what does that mean? He goes, never mind.
Never mind.
It was a different time.
Different time of my life, and so he's like, well, we need cartilage to anchor this. So he took like something from the back of my ear, put it here, anchored it. Anyway, it opened up my nose. Now I could breathe. So I woke up out of surgery, I had a big old wad in here, took it out. About 3 months later, I was healed. I didn't even know the blessing of
Breathing
what
through
I
your
was
nose.
feeling.
That's
I was
crazy.
like, so now I sleep at night?
As we all breathe
I
through our
know.
noses.
Yeah.
I didn't even know I was missing it, Dr. Calvert. I
Most
didn't
people don't.
I didn't even know what that was.
And when they get it fixed, they're just like, oh my God, you've changed my life. Like I
Yeah.
sleep better. I wake up rested. I don't wake up exhausted.
Yep.
You know, all those things come with the fixing the breathing, which is why, you know, again, you got to kind of go to people that do this stuff a lot.
Yeah.
You know?
My brother actually had a rhinoplasty done recently, and
Oh,
it was
no
the
way.
best thing. We're Jewish, so he was blessed with the nose.
You got the schnoz.
He got the schnoz. I somehow didn't, but so he went and got his done, and he said it was the best thing he ever did.
Yeah.
He's not only was it larger than normal, he actually couldn't breathe either, but he didn't know that was a reason why he wanted it done.
That's what I was
Yeah.
saying. I was like, whoa. I was like,
Yeah.
this is how
Yeah.
when I was running now,
We
I was
need
like,
to have Roger watch this episode. My husband's a Polish Jew. I was like,
Yeah.
he has the Jewish nose.
Hmm,
but
yeah.
not
he-
breathing is a big deal.
Yeah.
Like,
It's a
I
big
never
deal.
knew not
I don't
breathing
think
was
he
my problem.
realizes it.
Yeah.
when he's
I think it's hard for maybe more so for men to do something that they believe is cosmetic, which is why I even said about Terry Dubrow, like why now? But because it was something that was impacting his sleeping,
For sure.
it wasn't. So my dad has really bad teeth, but he's like, what am I going to do about it? Get new teeth?
Yes.
And people think that I'm vain. That's ridiculous. Like I've lived my whole entire life with these. It's fine. I think men have the same thing. So for your husband, he's like, no, I've had this nose this whole time. I'm not going to go and spend money on my nose.
Well, it makes a big difference to breathe at night because you wake up with a much better. Like it's
You
going to
feel
save your
rested.
brain. You know, it's
Yeah.
like dementia. All these like there's so much associated to
Wait, dementia.
to
What?
not oxygenating
Well, yeah,
properly
if
at
your
night.
brain
You need
isn't
to.
getting the
That doctor
oxygen.
told me that. He goes, you're going to get old quick if you don't fix your nose. I didn't know what he meant.
You got to get
That's-
his nose done.
Yeah.
I'm
That-
saying,
Wow.
Okay, well, speaking of
Oh.
husbands, I'm going to ask a question that my husband would ask every time I have a surgery. How long do we have to wait before we can have sex?
Oh, yeah. That's another question. When do I get to
that's
start
every
dating?
man's-
So,
I mean, you know,
and what happens if you have sex too soon before?
Did they break it?
Yeah.
so this is one of our most popular
Mhm.
podcast episodes. Is,
Really?
is when to resume sexual
Yeah.
activity after
Yeah.
plastic surgery. You need to know. I mean, a lot of the stuff that we
I want to start
do,
dating. I'm
Yeah.
excited
Yeah.
to take
Well,
these girls for a
Right.
run.
you should take them on a run. They should be good
Okay,
to go.
but when? I'm 5 weeks in.
I mean, you're in a little bit of a different situation. So if it's like a regular old breast augmentation, then you can, be gentle and get into activity after 10 days, even
And
7
also,
days.
don't you believe that if you was in a relationship, then you can probably go quicker. But if you're going to go and meet someone new for the first time and you're like, hey, you got to go slow.
Yeah.
You don't need
I
somebody
think-
roughing them up.
No.
Yeah, you don't want to have any like undue
I'm not
trauma.
saying masochism over here, masochism, whatever
It's not
they
even
call
that,
that.
but just like general like activity in the area. You want to take care of them. I mean,
okay, but,
Okay, say breast 10 days.
so wait, no, you said, but
In a
a regular
relationship.
breast
In a
job was
relationship.
7 to 10 days, but then
But Elizabeth's
what about
nightmare.
mine?
But something
You
more
like said
detailed.
you're not.
Yeah, you're like 4
I'd,
weeks.
I'd like to wait a little longer on yours if we can hold off till you give like before you
like
road test those babies. Give it probably another 6 weeks. You can have sex. You
6
just can't road
weeks?
test
What
these.
am I like?
don't
touch me.
No,
What if she has on the support bra?
Yeah.
Can
You
I
can
wear
wear
like
a
a
support
beware
bra.
sign?
Yeah, maybe get like,
under construction.
some sort of
Can you
chainmail thing.
imagine? You're like,
Don't
hey, you're at
touch.
the bar at Joey's. You're like, man, what are you doing? You know, blah, blah, blah. Take him home. You're like, yeah, anything but this.
Yeah.
Okay, so what about a tummy tuck?
That's more like a 2-month deal because you don't want to stretch the scar.
Oh, okay.
You know, that's
Sorry,
a big
babe.
deal.
2
You know,
months.
the scar is like a mess. So,
Yeah.
you know, you want to.
What's your
away.
husband over there doing right now?
He just threw
Wait,
it
the
back.
husband,
just
I'll be
left.
back here.
My husband just
husband's
went to
like,
find a
no.
new
What's
wife.
the talking about? The
Camera
tummy
husband
tuck.
just stomped his feet and stormed the
What
opposite
happened?
way.
What's the tummy tuck thing?
That wasn't a good answer, I
I
guess.
know. I'm like,
2 months.
Yeah.
why would you want a tummy tuck? Look how tiny
We've
you
talked
are.
about this. There's skin. There is skin.
Yeah. I mean, you
It
could.
is
You
there
have to
that
ask
just
your
needs to
surgeon because
be-
everybody does it differently. So, like, every surgeon will have a different recommendation
Yeah.
on that. But in general, you don't want the scar to stretch on an abdominoplasty. So, you're going to want to lay off of anything exciting for 2
Yes.
months. You
Do you
can
hear
still
that?
have sex. You just have to be creative.
Right.
No,
I mean, if you want,
Strenuous.
if you want to have a side discussion, I can give you some
Yeah.
ideas. I mean, but still, it's like
Use
Yeah.
your imagination.
like imagine you want to offload the scar. How might you be able to not put pressure on the scar and
Yes.
still have sex? I mean, there's two different issues there. So
Mhm.
I think if people are careful and creative, they can resume sooner rather than later.
I
If-
love this.
if you know it's
Careful and
gonna be-
creative.
Yeah, careful and creative sexual activity.
All
That's
of
what
a
I'm
sudden,
recommending. It's going to be a
Angela's
new public
husband's
service.
Careful and
excited
creative.
again. He's
Yeah.
like,
Let's
okay,
say
I
the
can do
double D
this.
is a double C.
Are you thinking about a careful and creative way to have sex with your husband?
Okay, so what about what's the
It needs to be
zip,
mindful.
zip,
Vaginoplasty?
zip?
What are you talking
Oh,
about?
labioplasty?
Labioplasty. Do you ever do that?
Wait, what
Yeah, I do
exactly
that.
is
you do
Yeah.
labioplasty?
I completely on the DL. I
Wait,
do
do
that
they
for
like
my
pull it up and
patients.
snip it and go?
No, that's not how you do.
Oh.
Oh, that's like right up there with stapling the sternum. I'm like, come on. Like
What
one thing
exact-
I have not learned tonight is new surgical techniques. So
Yes, yes.
that,
It's
that
not
is
writing
not
down.
happening.
So
I've learned
how
a lot. I
popular
just
is
want you to know.
labioplasty these days?
It's very popular, and it should be. It's a great operation.
Is
I
it
mean,
after the mom? Is it during the mommy makeover?
A lot of times we do it with the mommy makeover because
Isn't it meant to be super painful?
no, it's
But
really
what
not.
are the benefits to it?
So
It
if
looks
people have
nicer.
pain with intercourse because the labia like are long or they,
What do
When
you
we
mean
say
long?
like they get they can get long.
Wings of glory,
Yeah.
ladies. Hello.
What gets long?
Nobody wants
think
the high
Elizabeth-
school
Yeah, you got it.
curtain at the
No, what-
auditorium.
I don't have curtains.
No, what would make it
The auditorium's a waving. We're doing the wave.
What would make it painful? That's
it gets
my
If
If it
question.
gets stuck, yeah. If it's so long that
Wait,
it kind of gets twisted.
I just did a Kegel. Like when he
Yeah.
said that.
Wait,
So-
isn't it Kegel the thing, the balls they stick up there to strengthen your?
No, it's
You
like
can just Kegel right
you
now.
can Kegel on your own.
Just suck it up.
But when he just said that, you're like,
You suck it?
Yeah.
Wait, Kegels are the balls, like the labyrinth balls
No, you
from.
can do a Kegel
No.
right now.
No,
Pretend
Kegel's
like
an
you're
exercise
peeing
where you
Just suck
and
it.
stop
Oh,
peeing.
it's not the two balls you stick in there.
You can.
There's
that will
them as
strengthen
well.
those muscles too.
Yeah.
But
I'm so confused right now. A Kegel is the two balls, and then
no,
no.
a Kegel
That's
is an
something
exercise.
different.
I want to go back to
We're-
this
that- we're gonna-
labiaplasty.
we're gonna-
I'm super confused right now. So wait, you have
Listen,
to do a
after this
Kegel after
podcast, you and I are going to have a
labiaplasty?
chat. Yeah. You can,
I'm going to teach you how to
Did
Kegel.
I miss the
Take you to
conversation just
Biology
now?
101.
Okay, wait. So labiaplasty and Kegels have nothing to do with each other.
no.
Oh,
Well, if you do the
Sorry, I wasn't
vaginoplasty,
listening.
No,
you
it's
haven't got
all
to do the Kegels anymore.
No,
that's
because
for sure.
they're,
Right.
you're.
Well,
No.
so
It's not the pelvic floor.
no, the
is
pelvic
it?
floor. That is a vaginal tightening
Wait, what's a
operation.
pelvic floor?
what's the pelvic
Well,
If
floor?
you've
Yeah.
had a
that.
baby, you should know where your pelvic floor is.
C-section.
Oh, me too. I had two
But
C-sections.
when we do, when we do Kegels, that's where we're strengthening our pelvic floor.
Why would you want to do that?
Angela, show
Do you
us.
want
I
to pee?
Kegel if
Do you want to pee
somebody
your
says
pants when you
something-
sneeze?
Horrific. I'm like,
Yeah, you want to
ooh.
do your Kegels.
You want to do
Yeah.
your Kegels.
Men
So-
should do Kegels too. It's actually
I've
important
never
for.
do-
Here's
Am I-
here's the Pilates instructors.
Yeah, here you go.
I'll give you how to do a Kegel, ladies. You pretend like you're peeing. Stop peeing. Do you feel
Am I
that
doing a
muscle that
Kegel?
just like
Oh, yeah.
clenched? That's how you do a Kegel. You just pretend like you're peeing. I'm going to stop peeing, and that will help the pelvic
Now I have to
floor.
pee.
Now we all have to
Sorry.
pee.
I like that I'm sitting here with 4 women who are all clenching their
And now-
pelvises at the same time. It's just like I'm just like
okay.
I need to
We have Cinderella
I gotta
cakes
excuse
over here. We all get
myself.
cupcakes afterwards.
definitely.
But again, the
I'm gonna be
labia
okay, I
has
promise.
nothing to do with the pelvic floor. It's
That's just cosmetic, correct?
Okay, wait,
Unless
labia-
it
But
But
gets
you would only
caught
want to do that
up
if you
in
want to
itself.
tighten your
Wait, what do they
vagina,
call it?
right?
Beef curtains? Is that what we're
Oh
talking
yeah,
about?
the beef curtain.
Right.
Yeah.
So what do you do
Oh my
with
God,
them?
I have so many
Do you
questions
just
right now.
cut them off? Or do we
Fold it
sew
up?
them up? Or
So-
what happens?
We don't need them.
Wait, did you show them up? Is that how you go? Show them up?
I want to know.
I'm curious
You
too.
make me
This is so
Blush.
good.
And how long do
I
you
love
have to
this.
wait for sex with that?
That's
Because
gotta
that
be
sounds
long.
painful.
There's got to be a
They
60-day
actually heal
waiting
pretty quickly.
period.
I mean, usually 3 weeks is enough to wait on sex. Yeah.
Well, you can get that over
Because that's
a
butt
tummy
sex.
tuck.
I'm
Wait,
sorry.
Wait.
Maybe I'm
Are you
just
going to
gonna
tell
get
us?
that.
Do you sew
Literally,
them
that's
up?
butt
Do you chop
sex.
them
He's like
off?
3
What
weeks,
do we
then you
do?
can like
Burn
turn
them?
around.
So the labiaplasty comes in a lot of different shapes and sizes because it depends what the issue is. So the idea is that it can be for what's called dyspareunia, which is pain with intercourse. So if the labia minora are long, then we typically will trim them and we have to sew them in a way that you don't get scar contractures and problems. So it's a very artistic operation. We also reduce the labia majora, which is sort of the outer lips of the vulva and make those thinner, smaller. Some people need the opposite. They put fat grafting in there if things get too thin. So there's a lot of options. And then also we reduce the clitoral hood a lot of the times as well. So we have a whole podcast episode about it. If you guys want to go listen to it.
I just
Yeah.
learned so
And
much
can you
right
still
now.
cli-
Yeah.
Can you still climax the same? Could you give?
It should. I mean, there is a risk
But
that if
that's
so there is a
worth it.
risk if
Yeah.
you don't
Mm-mm.
you need the right doctor for this. I promise you, this has to be
Well,
done
who's the doctor in
correctly.
Beverly Hills? That's never mind. That's you. You do
Yeah.
it. But I mean,
no,
there-
I do it on the DL. I do it for my patients.
but who's
Like,
who's
that's-
I do
the
it for my
guy?
pleasure.
That's it. Like no, for
would
my
you say
patients, not for my
Doctor
Who would you refer
something.
people to? If
I-
they were looking for that.
honestly, my colleague Millicent Ravello, if they really want to get somebody who's good at it, she does a ton of that. So I send
Wow.
them to her, and there are a lot of people that do it around town. But Millicent's really, she's very talented, and there's a reason I took her as my associate, and she's, she does a lot of that stuff too because she does a lot of mommy makeovers.
Okay, so then they kind of
Okay.
just nip and tuck and nip and tick.
Yeah.
So I heard
Needs
that
some nice-
that if you take off too much of the wing,
Yeah.
or what's it called, the glory thing, that you could get bacteria in there. It's
Yeah,
not
you have
good to
to-
take too much
No,
off.
you have to. This is a
Wait.
very, very functional,
I know. I'm
artistic
like, what?
operation. And
Okay.
it has to be done right because
Okay.
I've had patients. In fact, one of my first patients when I did my residency training at the University of Pittsburgh and then came out and I was a professor at UC Irvine. One of my first patients at UCI was a patient who had a botched labiaplasty. And I honestly did not know how to fix it. And it was a mess. And she was in big trouble with it. And we did fat grafting. We did all, and I think we made it better, but it was really hard to come back from. So you got to get it done right. This
See,
is
that
really
was a
important.
Kegel all the way around.
Yeah.
I know. I was like,
That was a Kegel.
I just
Kegled
hurt
with
thinking
one,
about
too.
that.
Yeah, it was bad.
But
It was-
I mean, I all these different plastic surgeries, and there's so much that we as women do just for us that it's unfortunate when we find a bad doctor on accident. Oh, and we don't know what happened to us. And I felt so blessed to find you because, you could have as much resources as you want in the world. If you have a bad surgeon, you're fucked.
Yeah.
Like I was
Yeah.
literally fucked. And I couldn't go back to my old doctors because it's like, what's the definition of insanity?
Yes.
Doing the same
Fool
thing.
me once, shame on you.
Yeah.
Fool me twice, shame on me.
And I just said, I told my family, I can't do this again. I'm crying. I'm exhausted. I'm itchy. There's so many problems. So, I think that, what's your advice to somebody who wants to go and have surgery like a mommy makeover for themselves? Like, what's your advice on how to go about it? Like, first off, I know there's a lot of women that are watching this. I have 98% women on my podcast that are sitting home that just had a baby that are thinking, boy, for my push present, I would like to get a mommy makeover, honey. I mean,
Yeah.
how do they go about finding that?
What
What's
would be
the first
top
step they should
three
take?
things that they should?
What are the 3 things they should do?
I think the first thing is if you know somebody who has had one and had great results, to get a referral. That's really the bottom line. But I always say, start with the American Board of Plastic Surgery and find a board certified plastic surgeon in your area. Then look at the before and after photos, and then look at their patients. It really does come down to liking I tell
Yeah.
everybody who comes to me for a rhinoplasty, like, do you like my before and afters? They're like, oh yeah, they look great. I was like, okay, you're in the right place.
Yeah.
Because that's what I'm going to do.
Yeah.
Like, look at the people that I've done that are like you, because I do every ethnicity. I operate on noses around the world is my practice.
Can you tell the audience really quick your credentials, because you have significant credentials and you also train other surgeons right now. So you were trained where?
I went to Cornell Medical School, and then I went to the University of Pittsburgh for my residency, and then after that I started work at UC Irvine, where I was there for 3.5 years. I just didn't really like working for the state of California, so I quit and went private. I mean, it was fine, but it wasn't for me after a while. And then I have a fellowship program where we train plastic surgeons who've finished their residency. They're fully trained, they're board eligible, and they come with us for a year. And I have a group of incredible surgeons that we've amassed into this fellowship program. And it takes somebody who's a good plastic surgeon from a great program and turns them into somebody who's got, podium power and skill and game. And they come out of the gates and they really do great. So we're very proud of our fellowship training program because of the surgeons that we trained. It's been amazing.
Well, Dr. Calvert, we're very proud that you're here today. And you just being here in our presence and educating us and educating the audience on what they can do to get help if they've had a botched surgery, if they want a surgery, what to look out for, what to not look out for. Can they go to your website? Is there any resources on your website or?
Everything is on drcalvert.com.
Dr. Calvert, Calbert.
Right.
What's the name of your podcast?
The Beverly Hills Plastic Surgery Podcast.
The Beverly Hills Plastic Surgery Podcast. Well, thank you, Dr. Calvert, for being here today. We have a little gift from all of us to your wife, even though she wasn't here today. I think that just for letting us have you for an hour.
Well, thank you.
She can take this home and open it.
Yeah.
Just enjoy a little bit of love from Tiffany, since we all love Tiffany around here.
It's from you.
Thank you so much. No, I'll tell her it's from you, ladies. So thank you so much.
Absolutely.
I appreciate it.
And thank you so much. We hope to have you back and educate us more on maybe some more topics on some other procedures that we might or might not have.
Tops and
right?
bottoms.
Absolutely. Anytime.
Thank
I really
you.
appreciate
you
you
so
having me
much.
on.
No, absolutely. And you're right down the street too.
I am.
And I feel great. And I can't wait to be healed and to show you the results. I want to flash everybody right now, but I can't. So thank you for watching this episode of Girl Talk. I'm Elizabeth Vargas.
I'm Jody Silva.
Sophia Joels.
Angela Peretta.
And Dr. J. Calvert.
Like, follow, subscribe, and support us on Patreon. And watch the next video. Thanks for watching.
Bye.
Yay. Bye. I thought it was going to be really serious, and I almost started crying, and I didn't, so it was perfect.
Teared up.
I was like, don't do it.
Check this out.
Okay.